Hi, it's Liam here from Muscle Doctor, and today I'm going to be answering the question, what is soft tissue therapy? So to understand what soft tissue therapy is, it's helpful to have an understanding of what soft tissue is. Soft tissue is on your body and it's made up of muscles, tendons, ligaments, and fascia. So muscles contract and make your body move. So they tend to attach onto bones via tendons and they cross joints. So when they contract, they make that joint open and close. Ligaments attach bone to bone and they stabilize joints. And fascia is underneath the skin and it covers your whole body. It encapsulates every muscle, every bone, every cell in your entire body is covered in fascia. A helpful way to think about fascia is if you were to remove your skin, then everything would still stay in place. But if you were then to remove the fascia, then everything would just fall apart. So soft tissue therapy is the treatment of these structures. There are three main differences between sports massage and soft tissue therapy. So number one is that a highly qualified soft tissue therapist will look for the root cause of the problem. So if you were to come with them with an achy leg, they wouldn't just rub the leg. Sometimes that is the case, but more often than not, they'll look at the bigger picture and they'll try and find the cause of that problem and where it's coming from. So one example is IT band syndrome, which lots of people are aware of and have suffered from. So you might go to see someone and they might just pummel your IT band. Well, as many of us know by now, that's not the way to go with the IT band. It's something that can't be altered. It's a very thick structure, and it's probably better to look at hip mechanics and to look at gait and posture and things that might be causing excess tension on the IT band. That's just one example. So number two is that soft tissue therapists, as I said, I think of them as bridging the gap between sports massage therapists and physiotherapists. So in most cases, they will be able to give rehab advice and remedial exercises after the treatment is complete for the patient to carry out at home. Number three is, to be honest, I think massage itself can be taken in a derogatory way and undermines the ability of a fully qualified soft tissue therapist. So when you go into the clinic, you'll be greeted by the therapist and they'll usually give you some kind of a consent form to fill out to make sure that you're happy with the treatment and things can go ahead. They'll then talk to you and they'll take a subjective history. So this will consist of previous injuries, lifestyle factors, occupation, hobbies, any sports that you do, anything that could feed into the problem that you're having, and any possible causes for it. So after that, they'll carry out an objective assessment, which will involve them taking a little look at your posture, seeing if there's anything there that can be contributing to the problem that you're having, and then they'll get you to carry out some tests, which will usually involve the joint in question. So if it's your hip, they might get you to lift your leg up and down and side to side and that kind of thing. Then it will move on to a passive assessment, if applicable, which usually will involve you on the couch and the therapist moving the limbs around. In this instance, it's important to try and stay relaxed, which is actually a lot harder to do than you might think. So based on this, the therapist will come up with a treatment plan and they'll carry out the treatment, which will consist of soft tissue techniques, as I will get into later on. After this, when the treatment is complete, the therapist will reassess and they'll look for improvements and any differences from the first test that they did. And so based on this, they might carry out further treatment, or if not, then the treatment might be complete. Then you'll receive exercise advice and things that you can do in your own time at home or at work to help improve the problem until the next appointment. Another big difference between soft tissue therapists and just your average sports massage therapist is that they'll use a variety of techniques. Now, obviously, they will use massage, and that is a big part of the learning, the training of a soft tissue therapist. So, massage it can just be a rub, but in this case, a lot of emphasis is put on developing your sense of touch as a therapist. So, this will consist of many, many practice hours and being able to use your hands as a kind of ultrasound and to be able to get a good look inside that muscle and to feel for tiny little adhesions or knots and to be able to find out exactly what's going on. So if we were able to just lift up the skin and check underneath, that would be great, but we're not. So we have to use sensor touch. One thing that the course director of the course that I did advises in one of his books as a kind of sense of touch exercise is to use a phone book and to place a single hair on one page of the phone book and then to fold a page over. So obviously you've got that nice thin paper on a phone book. And then to sort of close your eyes and see if you can feel where that hair is. I never tried it, but I can imagine it's very hard. And then he says once you can do that comfortably, then put another page over and try again, and then put another page and try again. I'm not sure what the limit on pages could be, but you can see how that could lead into developing your sense of touch. Another exercise that he advocates is to put a lot of different coins inside your trouser pocket and see if you can identify which coin it is just by feel, which is actually a lot harder than you might think. So other benefits of massage are that they pump your lymphatic system, which is not pressurized, not like your circulatory system or anything like that. It needs to be manually pumped. And if that can't be done by the muscles contracting, then the hands of a therapist will do that. It helps to improve microcirculation, so it gets blood into the areas that might not otherwise receive it, and it acts as a pump to get those waste products out. And also, I mean, let's be honest, it just feels good. STR stands for soft tissue release, and it means that the therapist will apply what we call a lock onto that muscle. So what that means is that we'll use a broad part of our body, so usually like the palm of our hand, or maybe a fist or a forearm or something like that. What we will do is then take that limb into a stretch, and what that's doing is creating a kind of shorter attachment point on that muscle. So it's given a more localized stretch, it's given a more extreme stretch than you might be able to experience on your own without that. And it also allows us to target specific fibers within that muscle. When soft tissue therapists refer to neuromuscular techniques, what that means is that we're using techniques that work with the body and with the nervous system. So rather than just giving you a good pummeling, your nervous system will fight back against that and it wouldn't really achieve anything. So what we're trying to do is work with the nervous system and to get it to allow the change in muscular tension and to bring those changes on from within. So two techniques that fall under that category are METs, which are muscle energy technique, and NMT, which is neuromuscular technique, otherwise known as trigger pointing. So muscle energy technique is a technique that we will use and it will give you an increased stretch on that muscle. So rather than just yanking your leg, what we'll ask you to do is to contract the muscle in question. Now, if that muscle might be injured or it's unsafe to contract, then we can get this a similar effect by getting you to contract the antagonist, so the opposite muscle. So think bicep and tricep. We will get you to contract that for anywhere between 8 and 10 seconds. Everybody seems to do a different variety of this, but it has a similar effect as long as you're within the right guidelines. So I will get you to contract the muscle for 8 seconds, and then I'll ask you to take a deep breath in, a breath out, and relax. And then we've got about a 5-second window where we can stretch that muscle to a new barrier point. So what it's going to do is it's going to get more length out of that muscle, but it should feel the same to you. So it's not going to feel like an extreme stretch or painful or anything like that. And we're going to work completely within your pain barrier. So that's one of the neuromuscular techniques. The other is neuromuscular technique, trigger pointing. So what we'll do is we'll kind of scan the muscle. So here's where the massage technique and the sense of touch comes into play. So we'll scan the muscle, usually in a transverse direction, so across the muscle fibers. We'll sort of strum them like guitar strings, if you think of it like that. And what we're looking out for is a taut, palpable band, so a tight band of fibers, so one band that particularly sticks out over others. And when we find this band, if there are any bands, there might not be, we will then go in a longitudinal direction, so we'll go along that line of fibers. And what we're looking for is a small kind of pea-sized lump. So when we find that lump, we know that we've found that trigger point. So the treatment then will consist of applying pressure to that trigger point. And I like to describe this to clients as we're effectively turning it off and on again. So we're giving it a reset. So what we're doing is starving it of oxygen, and we're trying to get those muscle fibers to switch off, because that lump is actually a small a bundle of muscle fibers that are stuck in contraction, because it's more energy efficient for them to stay on than it is for them to turn off. So we're just forcing them to turn off. So that's neuromuscular technique. So hopefully that's given you a clear explanation of what soft tissue therapy is. If you liked it, then please like the video and subscribe and help me to grow my channel. And if you've got any questions or comments or anything that you'd like to say, get across to me, then just leave it in the comment section below. Thanks.